3 pieces of advice that I would give medical professionals for working with me, or any deaf person that speaks very well, is to keep in mind, just because we're speaking does not mean we can hear you. Do not turn away from us. It will not end well. We will miss out on information you are trying to give us. And legally, we are entitled to that information, especially when we are the patient. Another piece of advice I would have: if we ask you to speak up, we're not trying to be rude. We're trying to be involved in the conversation and be involved in our own healthcare, which every health provider should want a patient to be involved in their own healthcare. It's kind of what makes the whole system work. And lastly, it never hurts to learn a little bit of sign language. If you go on YouTube and just find things that say top 5 signs for medical providers, I know off the top of my head 3 different creators that can show you the sign for medicine, nurse, doctor, allergy, breathe, blood, pain. I think I said pain already. But those are the kinds of signs that you will use every single day, whether you are working ER, L&D, ICU, med-surg. It does not matter. You will use those every single day. Learn them. It will make your life so much easier.
Every time when we go to the doctor, we always let them know ahead of time so we can get a request of a live interpreter. And so with the live interpreter, help us so much so we can able to, for me and my deaf wife, so we can see the live person in both ways. But with the VR, which is the video relay interpreters on the iPad, and it's harder because they only just focus on the wife, but I cannot see what's going on because they only have a rule only focused on the patients. If my wife is in the hospital, I can't see or know what's happening with my wife.
I recommend all doctors or nurses that they bring in a live interpreter, especially for emergency rooms. A live interpreter is needed for any type of emergency situation. What if my husband broke his ankle? That did happen, and it was challenging. We need a live interpreter there. Video remote interpreters can be improved. That whole solution can be improved. It's not the best. I encourage all doctors to provide better visualization and to look people in the eyes and to reduce the amount of writing back and forth between the doctor and the patient. That's it.
We know that medical providers and staff strive to offer the very best care for their patients, regardless of language, age, race, ethnicity, and disability. Taking these simple steps shared in this video can improve quality of care and health outcomes for those you serve. Providing ways to effectively communicate with a deaf individual may require learning more about their needs, but as you do so, the outcome will be a high-quality experience and increased trust. As you provide services for people who are deaf or hard of hearing, remember to be flexible, considerate, and listen. Ask the deaf patient their communication preferences. When using VRI, include the best practices we shared in this video. Have a plan in place for serious situations, and include the deaf person in the process. When using an on-site interpreter, remember to engage with the deaf person, not the interpreter. As you can see, there is a lot to learn and incorporate, but as you implement these things, your efforts will be noticed and valued. We appreciate providers and staff for taking the time to learn about deaf culture and how to accommodate deaf patients in a medical setting. By putting these practices into action, you can make a positive difference in the lives of deaf individuals and help create a more inclusive and equitable healthcare system for all.